So I'm going to do us a bit of a whistle-stop through where we are in the current policy environment and think about what the opportunities are from that environment and what are the opportunities that we want to kind of generate, because they don't seem to be appearing. So just a little quick, hopefully you all know who we are because you're here in the building where our offices are. But we were set up by the Royal College of Physicians back in 1971 with a mission to end the harm from smoking. And we do that through a combination of advocacy and campaigning work and kind of policy information, policy sharing, research sharing, and so forth. And back in 2016, we published this report, which has been alluded to, which many people in the room helped us to pull together, The Stolen Years. In fact, Peter, who's going to speak this afternoon, it was Peter's title, The Stolen Years. We nicked it off him. And it helped us to create the Mental Health and Smoking Partnership, bringing together those partners in mental health and public health together to think about this big challenge, which we've all been talking about this morning in another slide, which illustrates the scale of that challenge. So here the grey bars are the numbers of people in the population that smoke, and the orange line is the rate of smoking within that population. So what we have is we have around, this slide is slightly dated, but we have around 6 million smokers in the general population. We have 1.6 million, roughly, people that smoke with depression and anxiety, but they make up around 26% of people with depression and anxiety in the population. And of course, we have this really big inequality, people with SMI, where around 41% of people smoke in that population, but they're a relatively small group in the overall group of smokers in the population as a whole. So this is to illustrate that we have the challenge of trying to address the inequality, which if we think back to the Mentimeter at the beginning, for many of us in the room, that inequality is at the heart of why we're here today. And why this is so important to us. But we also must remember, and Leonie slide, this like sliding scale where even people, any population of people with mental distress have this elevated risk of smoking. And so what we're trying to do with our policy work is we've been very focused on this big inequality, which is definitely the place for us to be, but we do want to expand and think about this bigger population of people with mental health conditions, with mental distress, who are at greater risk of smoking. That's really what this slide says. So, there's these big inequalities, and they are absolutely a priority for us, but we also want to think about this larger population of people with mental health conditions. And also, as we've been reflecting this morning, what the implications are, the mental health implications, the mental well-being implications are for all smokers from smoking. Because we know that for everybody, when they stop smoking, their mental health improves. That for everybody gets the pounds in the pocket when they stop smoking. And for everybody, it helps address concerns around poverty, etc. There are implications for the whole population of smokers. So this is what the partnership has been prioritising in terms of our call to actions recently. So the kind of 4 headlines here are around really improving the understanding around the relationship between smoking and poor mental health, particularly in our professional population, because we know that there are barriers to progress because professionals have not prioritised smoking in the population that smoke, and that stretches right across from primary care into kind of secondary mental health services. And so strengthening that understanding is really important, but also that the public should understand what the implications are of the relationship between smoking and mental health. But this is another route that we can explore for encouraging smokers to stop in the population, that benefits to their mental well-being. It's an absolute priority for us that smoking rates fall much faster in the population of people with serious mental illness and continues to be so. But also that we have, and what we need, we need the government to be setting objectives around that, but we also need the government to be setting objectives around the rest of this population at smoke with other mental health conditions. And that's received far less attention in the policy discussion to date. And the data continues to be a real challenge. Leonie was reflecting on the gaps in the data earlier, and that are being kind of filled through, investing in the smoking toolkit study. But it's been a perennial problem that really needs to be fixed. So Simon gave a bit of a preview to this slide in his slide, and sort of reflecting on what some of the big ticket policy changes have been in recent years. So the 5-year forward review for mental health was really great because it was a document that was about mental health, but it had reference in it about the impact of smoking and what we need to do for that population. And it called for all smoke-free, all mental health settings to be smoke-free by 2018. Ash did a survey in 2019, and we found that to be pretty uneven in terms of its implementation. And we know that the pandemic has been challenging for many settings in terms of keeping those environments smoke-free. And of course, when we're talking about smoke-free, we're talking about being in line with that nice guidance. So not just, we've put signs up and said nobody can smoke here, but the population of people in those inpatient settings are being properly supported around their smoking, and the staff as well. And we had this recommendation from the Science and Technology Committee in 2018 that was around vaping. We produced guidance on that we'll be updating. We're going to talk more about vaping throughout today. Then we had the long-term plan with this commitment around supporting smokers with mental health condition, which I'm sure many of you are out there involved in trying to implement. And again, we're going to hear more about that shortly. And then most recently, we've had the Core 20+5, which acknowledges the link between smoking and people with SMI, really, really important kind of policy tool for engaging integrated care boards and others in thinking strategically about how we can do more in this space. We had the CALM review in 2022, which made a recommendation around addressing smoking and mental health. But that's all to say, to lead to April 2023. And an announcement from the Public Health Minister, which I think many of you in the room would have seen those announcements a couple of weeks ago. The announcements that were made, Ash has been calling for a comprehensive tobacco control plan. We've been calling for more funding. We've been calling for things like raising the age of sale. There was much to be disappointed about, I think, in terms of the ambition of those announcements that were made several weeks ago. But there's also opportunities in some of this, and it's for all of us in the room to try and maximise those opportunities for this population. So one of the big announcements was a new scheme that the government plans to invest in, which they're calling a swap to stop scheme, which the detail of which remains to be seen, but the intention is around providing e-cigarette starter kits, particularly focused around disadvantaged groups in the population, as an additional aid to help more people stop smoking. And the headline figure was that they wish to provide 1 million e-cig starter kits. So good news. There was a call for evidence around youth vaping, and there was action investment around tackling illicit vaping. We can talk more about that if you want, but I'm going to park that a little bit for today. An announcement around incentive schemes for pregnant women. Again, not kind of core to today, but again, of course, we know that the women who are smoking during pregnancy are much, much more likely to also be experiencing other mental health problems. And then there was something around engaging with mental health services and noted IAPT and improving signposting for support. For me, that's obviously a big opportunity for us to try and really flesh out what that means and make that a big reality, because we've got this big population of people who are smoking with depression and anxiety, the very population which IAPT services serve, and an intervention point that could definitely be maximised in terms of getting more people to stop smoking. And so I think that will be a big focus for us to try and make that a reality and make that as good as it can be. There was announcements around trying to improve the access to varenicline, and many of you will know that Champix has been off the market for quite a few years now, so hopefully we will see a replacement to that soon, which is again really important for this population who might find it harder to quit and need another medication. And there was also an announcement around a kind of more quitting prompts in the packs. So that's a kind of whistle stop through all of that. I think the swap to stop and the engagement with mental health settings have potential for our population, and that's where we should be really putting our energy in. But there's more coming up. So we have the major conditions strategy, which has been announced as a bit of a replacement to various other strategies that were being planned around dementia and cancer and cardiovascular disease, etc. Bringing all of those things together, mental health is part of that. They've talked about prevention being part of the major condition strategy. What an opportunity for us to really get in there and demonstrate the links between mental health and smoking, which are so poorly articulated, I think, in many of the other policy documents that are out there. IAPT, there's new research due to be published shortly that we weren't able to bring to this conference, so look out for when that evidence comes out. We will definitely be holding some webinars and a real focus around that, because as I say, I think there's a big opportunity there. There's a real evolution around health inequalities in the Core 20+5 agenda in NHS England, and I think that there'll be much more scope at local and ICB level to kind of get into that space and make the case that this is a population of people that experience really profound inequalities, and addressing their smoking can help to address some of those inequalities. We hope that the NHS England will continue the rollout in inpatient secondary care, and will also continue to do that into community settings. But I do think there's a bit of a question mark around the funding for some of those things. As I say, there's an opportunity around the Swap to Stop programme, and there's also a Health Select Committee prevention inquiry with 10 different streams, one of which is mental health, one of which includes smoking, but there's lots and lots of opportunity to kind of get into Westminster and make our case. I think that's my last slide, which is good because I think I've run out of time. But I think there are opportunities in the next 12 months that we really need to seize and make sure that they work for people with mental health condition. But we need to continue to have the ambition, because what we currently have in place is not enough to get the job done. I'll stop there.